Welcome. If you are a loved one who's been diagnosed with diabetes or pre-diabetes, then you may be wondering what exactly is diabetes. You hear some medical jargon, but do you really know what is going on inside your body? So this short presentation will explain some of the need-to-know information about this condition. So what is diabetes? Well, diabetes is a metabolic disorder. The exact causes of diabetes are unknown, though they do know it's not a contagious disease. Diabetes tends to run in families, and there are several different classifications for diabetes. Type 1, which is often called juvenile diabetes, has no cure. Type 1 diabetes is an autoimmune disease. An autoimmune disease results when the body's system for fighting infection turns against a part of the body. In type 1 diabetes, the immune system attacks and destroys the insulin-producing beta cells in the pancreas. The pancreas then produces no insulin. A person who has type 1 diabetes must take insulin daily to live. Type 2 diabetes is the most common form of diabetes. About 90 to 90% of all diabetic patients have type 2. This form of diabetes is most often associated with older age, obesity, family history of diabetes, previous history of gestational diabetes, physical inactivity, and certain ethnicities. About 80% of people with type 2 diabetes are overweight. Gestational diabetes is a type of diabetes that presents during late pregnancy in some women. It generally disappears after giving birth. However, women who develop gestational diabetes have a 40% to 60% chance of developing type 2 diabetes within 5 to 10 years. Maintaining a healthy weight, eating a healthy diet, and exercising regularly can reduce these chances or prevent the onset. There are more rare types of diabetes that are related to other causes, such as cystic fibrosis, reaction to certain medications, and genetic defects. So let's go over some facts about diabetes. People with diabetes are more likely to suffer from complications such as heart attacks, strokes, high blood pressure, kidney failure, blindness, and amputations of feet and legs. In addition, an estimated 79 million U.S. adults have prediabetes, which is a condition in which blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. Prediabetes raises a person's risk of type 2 diabetes, heart disease, and stroke. Diabetes affects 11.3% of adults aged 20 and older, and about 27% of those with diabetes, 7 million Americans, do not know that they even have the disease. Prediabetes affects 35% of adults aged 20 and older. In most cases of diabetes among children and adolescents are type 1, which develops when the body can no longer make insulin, the hormone that controls the amount of blood glucose. Since diabetes is a metabolic disorder, we're going to take a look at a healthy metabolism. Now, metabolism is how the body breaks down food to be used. The food gets broken down into glucose, which is the form of sugar in the blood. After digestion, glucose passes into the bloodstream where it gets used by every cell in the body. For growth and energy, it runs every system in the body. For glucose to enter into cells, insulin must be present. Insulin is a hormone produced by the pancreas, which is that large gland right behind the stomach. And glucose is the main source of fuel for our body. Now, with diabetes, either the pancreas produces no insulin, or the pancreas is producing insulin, but the cells are not responding to the insulin that is produced. So the glucose builds up in the blood, overflows into the urine, and passes out of the body in the urine. Therefore, the body loses its main source of fuel, even though the blood contains large amounts of glucose. Now, when the cells in the body do not get the glucose that they require, diabetes results. Now, the first way is in type 1 diabetes. So think of this as you have lots of doors on the house, but no keys to unlock the doors and let the glucose inside. With the help of insulin therapy and other treatments, even young children with type 1 diabetes can learn to manage their condition and live long, healthy, happy lives. Now, with type 2 diabetes, things are a little different. Think about it as having lots of keys for the house, but there are no doors on the house to let the glucose inside. When you eat food, the body breaks down all of the sugars and starches into glucose. Insulin takes the sugar from the blood into the cells. When glucose builds up in the blood instead of going into the cells, it can lead to diabetes complications. After several years, insulin production decreases. The result is the same as for type 1 diabetes. Glucose builds up in the blood and the body cannot make efficient use of its main source of fuel. Take a look at some of the signs and symptoms of diabetes. Now, the symptoms of type 2 diabetes develop gradually. Their onset is not as sudden as in type 1 diabetes. Symptoms may include fatigue, frequent urination, increased thirst and hunger, weight loss, blurred vision, slow healing of wounds or sores. Many people have no symptoms. And hemoglobin A1C is recommended by the American Diabetes Association, and it is more specific on what your blood sugar has been over the past 8 to 12 weeks. It's recommended that this level be 6.4% or less. Now, the initial fasting blood sugar that you test that your physician takes gives you what your blood sugar was at that moment that you took the test. So that's good to know and take on a daily basis when you monitor your blood sugar. But for your physician to get an actual picture of how your blood sugar was over the last couple of months, they will order this A1C test. So remember, patients with type 1 diabetes do not produce insulin, or they produce very little. And doctors may also prescribe a different type of injectable medicine to go along with the daily insulin that they need. Blood glucose levels must be closely monitored through frequent blood glucose checking. People with diabetes also monitor blood glucose levels several times a year with that laboratory test called the A1C. Results of the A1C test reflect average blood glucose over a 2 to 3 month period. Patients can typically control type 2 diabetes with diet and exercise. Sometimes medications are also prescribed. Adults with diabetes are at a high risk for cardiovascular disease. At least 65% of those with diabetes die from heart disease or stroke. Managing diabetes is more than keeping blood glucose levels under control. It is also important to manage blood pressure and cholesterol levels through healthy eating, physical activity, and the use of medications if needed. By doing so, those with diabetes can lower their risk. If you are a smoker, stopping can also help lower your risk. People with any type of diabetes must take responsibility for their day-to-day care. Much of the daily care involves keeping blood glucose levels from going too low or too high. Proper diet. So the 3 goals of a proper diet are controlling your weight, keeping blood sugar levels at a normal level, and reducing the fat in your body. You can do these things by eating a lot of non-starchy vegetables and fruits, such as the dark leafy greens and carrots, and citrus fruits are rather low in sugar compared to a banana, which has a high level. So you learn about which foods are a healthier choice for your diet. Consume grains occasionally rather than daily, and choose only whole grains, not processed grains or flours. You want to include lentils and dry beans daily in your diet. Eat cold water fish 2 to 3 times per week. Drink plenty of water each day and avoid sugary drinks. Also avoid diet drinks. Cut back on high-calorie snack foods with little or no nutritional value. Things like chips and cookies. And be careful with your portion sizes because even if it's healthy food, you can still eat too much and gain weight. The Diabetes Prevention Program was a large study done in people with pre-diabetes, and it showed that 150 minutes of physical activity a week, which is 30 minutes 5 times a week, helped prevent type 2 diabetes. In this study, people also lost 10 to 20 pounds by making changes in their eating habits. Now, 30 minutes 5 times a week may seem hard to fit into a busy lifestyle, and it's not always easy to find the time. You won't go from 0 to 30 or even 60 minutes in a day or a week, but just take one step at a time and slowly build up to your goal of 30 minutes a day. All people with diabetes can benefit from checking their blood glucose. Using a meter is the most accurate way to check. Keep a log of your results and review them with your team to gauge how well your diabetes plan is working. The A1C test measures your average blood glucose control for the past 2 to 3 months. Check your A1C twice a year at a minimum, or more frequently when necessary. It does not replace daily self-testing of blood glucose. Checking your blood glucose at home with a meter tells you what your blood sugar level is at any one time, but suppose you want to know how you're doing overall. The A1C test gives you a picture of your average blood glucose control for the past 2 to 3 months. The results give you a good idea of how well your diabetes treatment plan is working. In some ways, the A1C test is like a baseball player's season batting average. It tells you about a person's overall success, not just how the batter did in one game. Hypoglycemia can occur as a side effect of some diabetes medications, including insulin and oral diabetes medications, the pills that increase insulin production. If your doctor prescribes medications, ask him or her to explain which diabetes medications can cause hypoglycemia, and have them explain how and when to take your medications. Following a healthy, controlled meal plan is important for managing diabetes. People with diabetes should eat regular meals, have enough food at each meal, and try not to skip meals or snacks. Now you want to get daily activity, but to help prevent hypoglycemia caused by physical activity, your healthcare provider may advise checking blood glucose before sports, exercise, or other physical activity. Maybe even advise having a snack if the level is below 100 milligrams per deciliter. You may have to adjust medications before physical activity. They may ask that you check your blood glucose at regular intervals during periods of physical activity, and maybe having a snack if needed. You want to limit use of alcoholic beverages. Drinking alcoholic beverages, especially on an empty stomach, can cause hypoglycemia, even a day or two later. Heavy drinking can be particularly dangerous for people with diabetes. Alcoholic beverages should only be consumed with a snack or a meal at the same time. A healthcare provider can suggest how to safely include alcohol in a meal plan. Serious complications arise from diabetes that are not well managed or controlled. Now, these complications include, but they're definitely not limited to, damage to nerves and blood vessels, diabetic neuropathy. Now, neuropathy is numbness or cold in the feet and lower legs. It usually involves the nerves in the lower extremities. People with diabetes should do foot inspections daily. And the sexual dysfunction, heart disease, kidney failure, blindness, high blood pressure. And I also want to point out that complications from diabetes affect different segments of the population disproportionately and also fall into, but not limited to, eye, foot, and skin categories. People with diabetic kidney disease can also develop high blood pressure.